Hi, I'm Dr. Anantharaman. I work with Magna Centers for Obesity, Diabetes and Endocrinology at Bangalore. Today I'll talk to you about thyroid diet. So what is the link between thyroid and our diet? So if you have hypo or hyperthyroidism, should you follow a specific diet? And some more other information I'll be giving you. Number one, the thyroid gland is a gland which is the size of our thumb. For example, if my thyroid gland, if you cannot see the thyroid gland or feel my thyroid gland right now, but my thyroid gland will be the size of my thumb. It's usually a small gland. If there is any nutritional deficiency or any nutrient is reduced, so the thyroid gland can compensate and enlarge several times in size. You can see that some people can have a thyroid gland which has grown several times, as big as a small watermelon. Okay, so that big increase in thyroid gland can happen, and the thyroid gland can compensate for a deficiency of a nutrient. So typically these kind of micronutrient deficiencies used to cause big goiters in the early period. So before 1950s, due to iodine deficiency, the thyroid gland used to enlarge in size due to the deficiency of micronutrients. So this is a normal physiological process. It is not really a disease. The thyroid gland was actually normal. It is trying to respond to a deficiency in the micronutrients. So this is one link between the nutrition and thyroid. So when it comes to hypothyroidism at this age in 2023, is there a diet that you need to follow to improve your thyroid function? The answer is no. You need not follow any specific diet to treat the thyroid dysfunction. Number one is that majority of the thyroid dysfunction today in 2023 is due to autoimmune thyroid disease, where your immune system is damaging the thyroid gland and not allowing it to function properly. So because of the autoimmune attack on the thyroid gland is not working. So giving it nutrients extra or avoiding certain nutrients is not going to help much in this scenario. Okay, so the problem itself is a different problem in 2023. It is not a disease of any nutritional deficiency. Having said that, even today we do get thyroid enlargement if someone has significant anemia. Okay, if hemoglobin is low, or if they have certain nutritional deficiencies like selenium, zinc, etc., because these are important cofactors for the functioning of the thyroid gland. Though the thyroid gland enlarges, it will continue to function normally, and the TSH is likely to be slightly high or normal, and it will not cause a very large elevation in TSH or overt thyroid failure like what we get in autoimmune hypothyroidism. So that is the link between hypothyroidism and diet. Okay, and many people say do not consume goitrogens or cabbage or cauliflower. So what happens when you take cabbage or cauliflower? When you take cabbage or cauliflower, these contain something called thiocyanates, and thiocyanates inhibit the functioning of thyroid gland. They prevent the trapping of iodine by the thyroid gland, and the thyroid gland has to actually become larger in order to achieve the same amount of iodine trapping. So these thiocyanates are of course present in brassicaceae group of vegetables, that is cauliflower, cabbage, etc. So there are some cultures in which people consume large amount of these food materials. So typically in our culture we don't consume so much of cabbage or cauliflower all at once basically. So if you are consuming modest quantities once in a week or sometimes a week, you need not change your dietary habits. So there is no such thing as a diet for hypothyroidism. And another important question that people ask me always is, when they have a thyroid dysfunction, either hypo or hyperthyroidism, should they switch from a iodized salt to a non-iodized salt? So for this also there is no evidence saying that if you switch to a non-iodized salt, your outcomes will be better. So and iodine is actually required for brain development, okay, and for normal physiology of several body organs, not just the thyroid gland. So that being the case, and India being a country which is endemic for iodine deficiency, we would prefer that everybody use iodized salt itself as recommended by the government, which is a public health recommendation. So it is likely to have more benefit than harm for an individual, and this has been decided after thoroughly studying our micronutrient status way back in the 1950s. So I would not recommend that you avoid iodized salt if you have thyroid dysfunction. Okay, so the final word is that there is no such thing as a thyroid diet. But the one thing you need to remember when you take thyroid medication, either anti-thyroid drug or thyroid hormone, you take the thyroid hormone at least 45 minutes before you eat or drink anything. So early morning when you wake up, take the tablet, wait for about 45 minutes and then take your coffee, tea or food. This is a very important step, because if you take the thyroid tablet and eat some food item within 15 minutes, the thyroid tablet will not get absorbed and your TSH will never normalize. So this is what typically a endocrinologist would advise you regarding thyroid and diet.